Hello, I am Dalberg. Welcome to this presentation. I am Chief Physician in the Pulmonology at Medical Department here in Kolding Hospital. Then we found out to try the O2matic. We have heard about it, of course. Somebody calls it oxygen robot. We look forward to have it in our hospital, and we had to buy some. It was easy, and we got this equipment in our department around November 2020. And that we did was to place the O2matic between the patient and the high flow, between the patient and the non-invasive ventilation, between the patient and the CPAP equipment. And then it was the O2matic that titrated the oxygen to the patient through high flow or non-invasive ventilation or continuous CPAP. And you can see on the left side, this is a COPD patient. We use it for some of them. On the left side, you can see it is titrated to 0.2 liter per minute. And then we can take these patients out of, for example, non-invasive ventilation. My problem was also to have the nurses to protect them against COVID. And here you can see in the beginning of September, October, the infection arises again. And this is infected nurses with SARS-CoV-2. And then you can see we got the equipment in November, but it took 1 month, around 6 weeks to train all the nurses. So in December, January, we were ready with this O2matic oxygen titration. And then the cure fall again. The nurses seems not to be so infected as before. Of course, we started also vaccination, for example, in the middle of January. But I think major effect is because of a very good titration of oxygen. So what was our experience and results using O2matic? It was for me very important to stabilize the patient, and that could O2matic. I could see if the patient was unstable and if the inflammation rise, the patient will move to intensive care unit 24 hours later. Now we had a protection of the patient. The patient is more stable. The patient can sleep. And on this equipment, O2matic, we choose the saturation interval between 92 and 96. And therefore the patient can be totally stable.